your Monday Minutes. Today, we're going to continue on with our environmental emergencies and focus on wrap up the heat emergencies element. Before we do, want to talk about, of course, why this stuff is important. And it's important, of course, for your exams because you're going to want to know these key elements when you're taking your EMS exams, but it's also great to know this stuff for your patient care, your clinical assessments, your decision making when it comes to transporting and treating your patients. In addition to that, it's great for your documentation and interaction with other healthcare providers as well. So, we're going to talk about heat exhaustion, and this is that more severe loss of fluid and salt for your patient. Some of the key findings you're going to see with these patients are things like pale or sweaty skin, maybe even hypotension. Patients might complain of things like headache or severe thirst, and they might have a slightly elevated temperature. It might even be normal. Okay, so what do we do for management for these patients? Well, management for these patients is pretty much common sense, right? But you're going to want to follow your local guidelines, of course. But some of the common treatment for these patients are things like getting them out of that warm environment, right? Get them to a cooler area. Maybe let them take sips of cold water, maybe even an IV, monitor an EKG, and of course, monitor and transport them to the hospital as well. So the other element of heat emergencies is heat stroke, right? This is that extreme emergency where the body cannot regulate its temperature any longer, okay? Some of the key findings for your heat stroke patients are things like no longer sweating, right? They're not sweating any longer, hot, red, or flushed, dry skin. They might be lethargic, weak, fatigued, okay? Things, uh, also things like nausea or vomiting, maybe even dizziness, okay? And your patient might be confused as well. They might be acting irrational and might have that altered level of consciousness. And of course, that increased body temp as well. So, what are some of the management things for heat stroke patients? Again, a lot of it's common sense, right? You're going to get them out of that cold area. And you might even do things like ice packs, where you're going to put them things like the neck, the armpits, the wrists, the groin, things like that. Okay? And also might consider things like even fanning your patient. And also, of course, your IV, EKG, your monitoring and transporting of the patient to an appropriate facility. So, guys, listen, I hope you have enjoyed these Monday Minutes. Very compact, very quick, but some key elements here, and I hope you can use them in your day-to-day activities. Um, if you have some minutes of your own, I'd love to hear what you have to say and what your suggestions are for the show. Go ahead and contact me. Lots of great ways to get in touch with me. One of them is sending me an email. You can send it to contact@emsofficehours.com. You can also get in touch with me on various social media platforms, Twitter, Facebook, YouTube, and even Instagram, where I'm also there at EMS Safe there as well. Okay, guys, so I hope you enjoyed these. Do me a favor, leave me a comment below. Let me know what you think about the show. Um, and as always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.